Welcome to the Vaccine Hesitancy podcast. My name is Joshua Kelsall from Warwick University. One of the aims of our podcast is to discuss the causes of vaccine hesitancy, with a view to informing philosophical research into the rationality of vaccine hesitancy. In today's episode, I am talking to Dr Helen Skirrow about her research on the attitudes of pregnant women towards COVID-19 vaccines in the UK. Helen is a clinical research fellow and public health specialist registrar in the Department of Primary Care and Public Health at Imperial College London. Links to Helen's research can be found in the video description. Hi Helen, please could you introduce yourself?
Yeah, hi, great to be here. So my name is Dr Helen Skirrow. I'm a medical doctor by background, but after my junior doctor training in various London hospitals, I decided to specialise in public health medicine. That's a sort of junior doctor training programme for public health professionals, and I'm currently taking time out of that training to do my PhD. I'm funded by the NIHR National Institute of Health Research, and I'm based at Imperial College London. My PhD is all about childhood vaccine uptake and pregnancy vaccine uptake.
Could you say a little bit more about some of the research that you did specifically on vaccine hesitancy among pregnant women?
Yeah, so I don't like to call it vaccine hesitancy in my research, I have to say. I really like talking. I do a lot of work, obviously, in my job as a public health doctor. I sometimes have to speak to families who may have chosen not to get their children vaccinated, for example, if there's a measles outbreak. So I don't really like to talk about hesitancy, and among pregnant women as well, I really like to use the word confidence. You know, how confident are they about getting vaccinated? My work among sort of pregnant women and getting vaccinated, we did an evaluation of a midwife delivered service in London, vaccine clinic, to see if there's differences in the women that were getting vaccinated against flu and whooping cough pertussis vaccine in pregnancy or not, and sort of how that service was used by pregnant women. And then during the pandemic, we did a large study looking at attitudes to COVID-19 vaccination and access to pregnancy vaccines. And we were really looking at how the pandemic had impacted that confidence and attitudes to pregnancy vaccines, but also childhood vaccines as well, access. And then we were also interested in access. So how had the pandemic impacted pregnant women's ability to access vaccinations during pregnancy, and also vaccinations for their baby? And then also sort of overall, what was their attitudes to taking a COVID-19 vaccination if one became available? Because my research was done in 2020, so it was sort of quite theoretical at that stage.
Did you find that there were any significant differences between hesitancy or confidence among pregnant women with vaccines, specifically to do with COVID, and then in comparison with other vaccines like the flu vaccine?
So I think we did find a correlation between pregnant women who hadn't been vaccinated against pertussis, whooping cough, in their last pregnancy were much less likely to be willing to accept a COVID-19 vaccination in pregnancy. So there was a correlation between existing uptake of existing pregnancy vaccines and COVID-19 vaccinations. However, so the survey, we did both sort of quantitative analysis and qualitative analysis. So a lot of the qualitative findings really found that pregnant women were very worried about the COVID-19 vaccine being a new vaccine. It's been rushed. You know, how will we have the safety data for it? So I think that is different from existing vaccinations. My research is UK based. We've been vaccinated pregnant women against pertussis since 2012, so at the time, a really long time. So it was much more sort of accepted, whereas there's a lot of comments about, I'm concerned about a new vaccine for pregnant women. I wouldn't want to take that until we've had years of safety data available. So I think there is a difference between the COVID-19 vaccination attitudes and existing pregnancy vaccination attitudes. However, the things that we can learn about those sort of women who are less likely to accept vaccines in pregnancy are also less likely to accept a new COVID-19 vaccination as well.
Do you have any thoughts on why, or any speculations on why you think that might be?
So I think confidence in vaccinations is multifactorial, and it's influenced by many different factors to do with a person's demographic background, what their experience of healthcare has been to date, their overall confidence and trust in the healthcare system and how they've been treated. So I think the things that make you confident in existing vaccines will track into COVID-19 vaccinations. And we do find ethnicity variation in existing vaccinations, in childhood vaccinations, and also COVID-19 vaccinations. There are some ethnicity groups that are less likely to accept vaccinations, and that includes for vaccinations in pregnancy. The difficulty with ethnicity is that a lot of the research, including a limitation of my own research, is underpowered to detect really granular demographic differences between different ethnicity groups. We often just aggregate white ethnicity groups and then sort of other ethnicity groups. Whereas actually, and it might be just that we look at Black ethnicity groups or Asian ethnicity groups, whereas actually it's a lot more detailed than that. And you get a huge variation in uptake between different ethnicity groups. And we really need to get a lot better at recording ethnicity and also acknowledging that there are huge differences between different ethnicity groups.
So one of the findings of your research was that when you asked pregnant women to consider whether they would get a vaccine if they weren't pregnant, you found that when they were asked to consider that, they were a lot less hesitant than if they were pregnant, or if they'd already had their baby, if they'd get a vaccine afterwards. I wondered if you could just say a bit more about why you think pregnant women make these distinctions.
Yeah, we found a huge difference. So we found sort of confidence of over 80% if you weren't pregnant, but sort of it dropped down to about 61% if you were pregnant. So pregnancy, it's a different time for women. It needs different communication compared to other vaccinations. We need to acknowledge that the decisions that women make when they're pregnant, or potentially trying to get pregnant as well, are going to be fundamentally different to decisions that they may make when they're not pregnant. So I don't think it's a surprising result, given the fact that pregnancy is such a different stage in women's lives. That being said, a lot of women do get pregnant and have babies. It's also a very normal thing to do. So we need to get better at acknowledging the fact that the decision making that happen during pregnancy are different, and there are different factors that affect that may affect a decision when you're not pregnant. And we need to get better at actually communicating that and making it more routine for vaccination to be seen as normal in pregnancy, which, to be honest with you, we actually have pretty good uptake in this. We don't do very well with influenza, and there has been a dip during the pandemic, and there's always more work to do. But actually the UK is pretty good, sort of in terms of vaccine confidence. But it's just this variation between different groups that we really need to tackle now.
So just to go back to something you said previously about the kind of multifactorial dimensions to hesitancy. So your findings reported that minority ethnic women were most likely to report feeling unsafe when attending vaccinations. I was wondering if you could just say a bit more about what you mean by unsafe here, and how you think that medical professionals might avoid people feeling that way.
So I think we've got to take those findings in the context of when this research was done, which was at the height of the first wave of the COVID-19 pandemic. So we were really trying to tease out how safe pregnant women felt about attending healthcare settings for things like vaccinations. So a lot of the qualitative responses found, I was really worried about contracting COVID-19 if I attended for my vaccinations. And that concern about their own health, but then also for their babies and infants getting the vaccination. How safe is it for me to attend a healthcare setting to get a vaccine, given we're in the midst of a global pandemic, the huge uncertainty in the summer of 2020 about the risks to pregnant women? It's got to be seen in that context of feeling unsafe in the context of the pandemic, I think. And so a lot of the qualitative findings really reflect that sort of feeling of being unsafe.
One of the other findings of your research was that I think it was 45% of women found it difficult to physically access the vaccine. So is this something that relates to that issue around getting routine vaccines, and what kind of access problems are faced particularly by pregnant women?
So a lot of the qualitative sort of free text responses that we got, and also that we found in the in-depth interviews, was that pregnant women, and it links very much to my previous point, pregnant women felt that vaccinations were really hard to access for them during the pandemic. I had to call my doctor multiple times, had to call the midwife, had to remind them, and one of my favourite quotes, or not my favourite, but one of the really pertinent quotes from my research is, it's a good job I've been pregnant before and I knew that I had to get the whooping cough vaccine in this pregnancy, because otherwise I don't think I would have got it. So they really had to rely on that previous knowledge from previous pregnancies, and also awareness of how you get the vaccine and things like that. And just actually really sort of devote some time and effort, attend a different appointment to get those vaccinations. So when we talk about access, that's really what I'm kind of looking at, is how easy is it for pregnant women to really make those appointments and access those vaccinations.
Good. I think it's also interesting because, in a way, this access problem, it seems to me that it's not necessarily that someone might be hesitant to get a vaccine. The concern might just be, look, it's just quite difficult for me to get a vaccine.
Definitely. I think we have to be clear that there is an issue with vaccine confidence, but also there is an issue with how easy is it for pregnant women and children and anyone to access vaccinations for their children, and also when they're pregnant. I think that's a huge area. And there's a really interesting paper. It's used the sort of Bradford Hill criteria of causality to look at whether anti-vaccination sentiment has caused the decline in childhood vaccination uptake, and their conclusion, sort of applying those sort of, looking at causality, they sort of think that vaccine confidence may not be responsible for the declines in childhood vaccination that we saw sort of because it was declining pre-pandemic. So there is vaccine confidence as an issue, it's not denying that, but there are other things at play here that impact on vaccine uptake that we need to understand, and also how that interplays with vaccine confidence. Because if you already have questions about vaccinations, which is entirely normal, I work in vaccination. I think vaccination is one of the single greatest things that we've achieved as human beings to prevent infectious diseases and reduce morbidity and mortality. But of course, I want to know what vaccine I'm getting. I want to know, how I'm going to feel the next day. I have questions that luckily I've got the information and the access to those things to answer. But if you already have questions about those vaccinations, and then we add in the double layer of making it hard to get to somebody who can answer those questions and then get the vaccine, that's going to really mean that if you're already a bit underconfident about getting vaccinated, are you less likely to just get vaccinated at all? So it's not just about sort of anti-vaccination people who, I'm not going to get vaccinated. It's those people who have questions. Are we actually giving them enough opportunities to ask information and get the information that they need from trusted healthcare professionals?
It kind of ties into another consideration. So with this project, what we're interested in, or one of the things we're interested in, is trying to understand the reasons that people have to be vaccine hesitant and the rationality of those reasons. Now, in the case of pregnant women, it seems like there might be special considerations that pregnant women have relating to the fact that they bear a responsibility for their unborn children. And pregnant mothers may feel that burden more than, say, a doctor might, and that might play a role into how they respond to vaccine advice. So I was just wondering, do you think these kinds of considerations about the obligations of parents or mothers play a role in why someone might be less confident in a vaccine or have more questions about a vaccine? And do you think that it's reasonable or rational for women to have concerns in that kind of way?
Definitely. I mean, I think the sort of research that I've done, and obviously lots of people have done lots more than me, but there's a lot of comments like, I will do anything to protect my baby. I don't want to do anything that's going to harm my baby. This is, it's felt by women that their job is to protect that baby. And when I've worked with vaccine midwives, they often say, you don't know, if you've only got 5-10 minutes to speak to a pregnant woman, you don't know the story about what's gone into achieving that pregnancy. You don't know the background. Have they lost a baby before? So there is this huge sense that, that it is the job of the pregnant woman to look after that pregnant woman, that baby. And I think they bear a huge responsibility, and they're constantly bombarded by, don't do this, do this, do this, and it doesn't matter how many times, I don't know, if a miscarriage sadly does happen, how many times a pregnant woman is told by a healthcare professional or nurse, it's no blame or nothing, nothing you would have done. And this is not my area of research, this is just from me reading other research. There is still a feeling that have I done something to cause this? So I think pregnant women do bear a huge brunt of responsibility. Just as a counterpoint to that, though, what I found with my public involvement and co-production research on both pregnancy vaccines and childhood vaccines is that vaccine decision makers are not just the pregnant women in the household. So we found, when I did a small sort of public involvement project looking at sort of why were some pregnant women not getting vaccinated in a particular area of London, we found my mother-in-law told me not to get vaccinated because she's never had vaccines in pregnancy, and I live with my mother-in-law and she makes all the decisions. My husband didn't want me to get vaccinated during pregnancy because we just moved here and I wasn't offered a vaccine when we lived abroad before, and we've arrived in the UK. This is new to me. So I think the pregnant women bear a huge that responsibility and feeling of responsibility. But vaccine decisions are not made in isolation by pregnant women. There are other family members and household members that influence those vaccine decisions. So we need targeted information and specialist information for pregnant women, but we also need to acknowledge that they are not isolated in that pregnancy.
So maybe thinking a bit more about that, so about who we might target to kind of improve uptake among pregnant women. What would you recommend to science communicators and medical professionals who are trying to improve that uptake, and how do you think you would encourage them to go about that?
It has to be super clear. So my research was obviously before pregnant women were offered the vaccination, but I have done some work as part of my PhD since then, particularly on this co-production study, and working with sort of local community groups. And there was quite a lot of confusion because pregnant women initially weren't recommended the COVID-19 vaccination. Then they were recommended if they were high risk, if they had certain medical conditions, or if they did certain occupations that put them at high risk of COVID-19. Then they were recommended at the same time as their age cohort was recommended. And then it wasn't really until late 2021 that they were actually put into a priority group. And so now what we're seeing with this autumn booster campaign is that pregnant women are a priority group. They are getting that prioritisation. And the impact of that has been that I think pregnant women potentially, and feel quite rightly, a bit confused about the COVID-19 vaccination for pregnant women. So I think we need to be really much better at providing clearer communication. Obviously, the COVID-19 vaccination, it was a kind of unique situation, and I understand why we did what we did. But actually, we know about pregnancy vaccines. We've been doing it for years. We've got good science about it. So I think we could have done it better, and I think we could have communicated better about pregnancy vaccination. And I think the confusion that was felt and the subsequent impact that we had of, sadly, pregnant women who were unvaccinated being admitted to intensive care, and sadly some deaths as well. We don't know, but could they have been prevented by clearer communication? I also personally think that to inspire vaccine confidence, we really need to make sure that we get personal stories out there. And there have actually been, I think we've got better recently. There's been some really powerful stories of women who got COVID-19 during pregnancy. They've been on the BBC News website. They've been sort of shared. But I think in general, what happens is anti-vaccination stories can be quite personal. This is what happened to my child after a vaccine. Very graphic, horrific visuals and videos about what happened. Sadly, happened around the time of vaccination, not linked to, but gets sort of jumped on as being a link and a causation to a vaccination. But they're very powerful. And when you're a parent or when you're pregnant, you jump on those. And I think we need to get much better at sharing those stories of people who have been affected by the infectious diseases that we're trying to prevent through vaccinations, or really powerful stories about how important they are. There are some videos out there. There are organisations such as Shot by Shot, like for Riley in Australia, Riley was a little baby who died of pertussis before maternal pertussis was available. There are some organisations that do this, but I think we need to get a lot better at sort of these powerful stories of the impact of infectious diseases on an individual and their family as well, and why it's important that we do prevent them through vaccination. Clearer communication, the use of personal stories. I think also we need to empower those frontline healthcare professionals who may not have the confidence. So midwives play a huge role in pregnancy in the UK. And there are educational modules available from Public Health England now, UK HSA, about sort of pertussis vaccine in pregnancy and flu vaccine in pregnancy. But do midwives, and again, I haven't studied this in particular, but I have worked with pregnancy vaccine midwives who are confident about talking about it. But a lot of them say, you know, other colleagues who may be seeing pregnant women day in, day out, have they actually got the information to answer those pregnant women's questions? And they may not, but they actually are probably the ones that pregnant women are going to be asking. And it may be that they just trained before we offered pregnancy vaccines. You know, we only started offering flu vaccine in pregnancy in 2010 and pertussis in 2012. So even though we've got good data on safety, it is a relatively new thing. If you trained in the 1990s as a midwife, pregnancy vaccines weren't a thing. So do we actually have those healthcare professionals who are confident about talking about the vaccine? And not being patronising as well. I think, as I said, it's perfectly rational and normal to have questions about vaccination at any point in your life. And I don't begrudge anyone asking me a question about the safety and effectiveness of vaccinations. And the medical professionals can be very dismissive and say, oh, they're anti-vax. They're a load of rubbish. That's not true. The majority of people who don't get vaccinated, they're not hardcore anti-vaxxers. They just have some questions. And are we able to address them without being patronising and acknowledging that actually they may be rational questions that we just need to answer and not dismiss them as being anti-vaccination? And I think we have to be very, very careful about making sure that people don't feel that they're just stupid for having a question about a vaccination.
So I think one question to end on then, and thinking maybe more about the kind of research going forward rather than the work you've done. So can you identify some research questions or topics that you think are especially urgent for projects within this kind of area of hesitancy, trying to understand it, to address?
So I think I'm in my PhD, I'm looking at the impact of the pandemic on routine childhood vaccine attitudes. I think the impact of the pandemic on routine vaccination is really, really important. How has it changed how people view vaccination? I think the childhood vaccination, it's a whole other topic. For COVID-19 vaccines is a particularly interesting area because it was offered as a non-urgent offer for 5 to 11-year-olds in the UK, COVID-19 vaccinations. And it was left very much for parents to choose whether they wanted to get their children vaccinated against COVID-19 if they were aged 5 to 11. And we have diverged. And for example, the United States have recommended vaccines for 6 months to 5-year-olds, whereas the UK hasn't for all of those age groups. So I think that's a really interesting point because normally the vaccination programs are quite clear for children, that, you know, we recommend that all children get this. There are some selective vaccinations, you know, that we offer to children with particular health conditions, or they may have been prioritised for previous vaccinations before different cohorts. But I think how that plays out is really interesting, and how well, we weren't really recommended the COVID-19 vaccination. So if there's a new vaccine that's brought on, our parents are going to say, well, is this actually really important that I get this vaccine? Is this actually a really important vaccine we get? Or is this a bit like the COVID vaccine that's not urgent and it's just up to us? So I think how that impacts on vaccine confidence is really interesting from a childhood vaccination perspective. But yeah, I think it's going to be a lot of research and for a long time as to the impact of the pandemic on vaccine confidence. I think it's we've never talked about vaccines more in the public in my lifetime. And I think it'll be really interesting to see what happens over the next few years in terms of routine vaccine uptake and also COVID vaccine uptake as well, for different demographic groups. Because as COVID disappears from the front of people's minds, how much are those prioritised groups going to actually come forward to get their vaccines? Are they going to see them as a priority or not? And we still don't get great uptake for pregnancy vaccines from flu, so we need to be careful.
That's excellent. That's it for our questions. So thank you, Helen, for your time. That was really interesting discussion on hesitancy.